So, welcome, folks who have joined us. Thank you for taking the time this morning to be here for the second installment of our Take Care Demystifying Insurance and Care Options for Independent Arts and Cultural Workers series. We are thrilled to continue this unique series with this workshop this morning. This workshop is titled Benefits for Non-Traditional Workers, Decoding Our Complicated Benefits Landscape and Investigating the Promise of Portable Benefits. My name is Kinsey Keck. I use she, her pronouns. I am a white woman with brown hair. It's currently pulled up in a ponytail, and I'm wearing some large round wireframe glasses and a sort of burnt orange and cream tie-dye sweater. And I'm sitting in front of a window with some generic kind of white curtains hanging over it. I'm also the programs director here at the New York City Arts and Education Roundtable. For those who don't know, the Roundtable is a grassroots service organization that works to advance arts education in New York City, New York State, and beyond. Although we are currently meeting online via Zoom, the Roundtable would like to acknowledge that we do work and live on unceded lands. Mannahatta, or the place widely known as New York City, exists on the contemporary and ancestral homelands of the Canarsie, Munsee Lenape, and Wappinger people. These sovereign nations and communities are still thriving here, and we continue to occupy their lands. We would like to give a moment of respect to them, as well as to the Black and immigrant communities, which have helped build the city that we know today. As we recognize that all of our pasts, presents, and futures are intertwined, we would like to uplift just a handful of some contemporary Indigenous arts organizations that we can all support and learn from. So I'm just going to paste those names and links in the chat. Please save them. Take some time when you can to get to know these organizations. Do some research of your own about what organizations are in your area that you can get to know and support, hopefully with donations. I also invite you to share any organizations that you would like to uplift in the chat as well. Just a few reminders: if you're having trouble with Zoom at all today, you can send me a private message. My name is Kinsey. You can also send our fabulous Roundtable intern, Virgilio, a message, who has here. He's joined us and just gave a little wave. Please do keep your mic setting on mute if you're not the person speaking, so we can all hear each other clearly this morning. We encourage you to use the chat to connect with folks on the call, but also to share your questions. We will have some time for Q&A at the end of the session. So you can just put all your questions there. We will collect them and get to them as quickly as we can. I also want to note that this call includes captioning. So to activate your captions, you can navigate to your toolbar. It should say either live captions or live transcript. I see someone has turned them on now, and then they may be under that more button as well. But once you click that, you can click show captions and they will automatically generate for you. And last, I want to share that this session is being recorded, and it will be made available to registrants after the closing of this series, along with all of the other links to videos and resources and all of that good stuff. You will get all of that in a follow-up email from me, so you can revisit whatever you missed or stuff that you just want to watch the replay of. And I think that is it for me. Thank you for listening. Now it is my pleasure to turn it over to our facilitators for today. So thank you both so much for joining us. I'd like to introduce Lexi Gervis. Lexi is a PhD and the VP of Impact at Steady. And we're also welcoming Eddie Torres. Eddie is the president and CEO at Grantmakers in the Arts. Thank you both so much for joining us this morning. I turn it over to you.
Thank you, Kinsey. Thank you so much for having me. Is sound okay? Yeah, okay. Just moved. So first morning in a new empty apartment. That's the empty bookshelf behind me, unlike Eddie's. Very robust bookshelf. Thank you so much for having us. Today, I'm going to go over a little presentation I put together to kind of lay out the landscape of the benefit system. And then I'm going to invite Eddie in, and we're going to have a conversation together about portable benefits, kind of current state and advocacy efforts. So if you have any questions, we have a small group, so please put them in the chat and I can just try to answer stuff as we go along. And I will share my screen and get started. Hold on, you think after this long of using Zoom, this would be more seamless. Here we go. Okay, is everyone seeing that? Great. Okay, so as Kinsey said, today's discussion is benefits for non-traditional workers. So we want to decode our really complicated benefit landscape and investigate the promise of portable benefits. So just to do a quick roadmap of where we're going to go today, in case this is helpful. First, we're just going to talk about the kind of different set of benefits. There's public benefits, there's private benefits, and then in case that wasn't confusing enough, there's some that are both, a combination, public and private benefits. Then we'll talk a little bit about public benefits and how to access them more easily in New York State. Then we're going to overview what portable benefits are and what they mean for artist educators for this group. And then Eddie and I will be in conversation around advocacy. Great. Okay, so this is a little bit of the history lesson part, but I think it's really important to think about. Over time, we have had this shift from thinking of benefits as something that we collectively do together, sponsored by the government, to something that we do individually. And that's really important for portable benefits. That has to do with the employment structure. But when our benefit system in this country started was in 1935 with the Social Security Act. And this was the government saying, it is on us to collectively make sure that everyone is insured against things happening. So that's losing your job, getting sick, losing money unexpectedly, disability. The Social Security Act kind of ushered in this era of public risk pooled social insurance. And risk pooled is really important because that's actually what makes insurance more affordable. When we're going out to buy insurance individually on an individual in a marketplace, insurance is really expensive. But when you have large groups of people that you're insuring, you actually can get the price of that insurance, whatever kind of insurance it is, much more cheaply. So the benefit of the government being involved was that then insurance could be risk pooled, so it could be much more affordable. So Social Security, our retirement, is really actually the first portable benefit. You get it no matter what. I'll get into that a little bit more. And it pays out to you in your retirement age. But at the time, unemployment was also formed, disability insurance, and health insurance was actually left out at the last minute. And really importantly, domestic workers and agricultural workers were left out of the Social Security Act. And this also has relevance for portable benefits later on. This was, big surprise, a group of white Southern lawmakers who lobbied to leave these workers out of the Social Security Act. And that meant leaving this type of employment, which is independent contracting, the original gig workers, also out of the Social Security Act. So that was kind of the origins of that. And agricultural workers and domestic workers at the time were largely people of color. So that's kind of the origin of where we see our employment structure today. But for the most part, we said the government is going to take on collective responsibility and risk. And then that has just shifted over time to become more individual responsibility. So in 1942, health insurance became completely privatized. That started during a federal pay freeze, but the IRS later supported it by doing tax exemptions. And that's kind of what the government has done since then. They've incentivized private employers to continue to offer insurance through tax breaks so that the government didn't have responsibility to insure people. So the same thing happened in the 1970s with retirement plans. There used to be guaranteed pension plans, but 401k plans, which are individual responsibilities dependent on your employer, became more popular. And our suite of benefits has kind of followed suit from there. So we see this, a scholar called Jacob Hacker talks a lot about the risk shift. So this is this risk shift onto individuals. And that's meant that a lot of our current benefits landscape is private. And that means it's offered by an employer to the employee. And that's typically only in the case of standard W-2 employment. So that includes healthcare, retirement in the form of 401k, not Social Security, paid time off, paid sick and safe time, paid family medical leaves, and workers' compensation. So if benefits are no longer collectively offered, they're tied to your employment and they're privately provided, right? This obviously leaves out anyone who doesn't have a standard W-2 relationship, which we know is increasingly a ton of people, right? They're really left out of this private benefit system. And this has this origins in leaving domestic workers and agricultural workers out of the first set of benefits in 1935. So this is what's currently offered privately, which a lot of people don't have access to. There's also this set of benefits that are private and public, which is this hybrid that means to access them, you have to have an employer who's paying in on your behalf. So they're private, they're provided by the government, so they're public, but they're dependent on someone paying in. So in the case of unemployment, you can only earn unemployment if you had an employer who was paying in on your behalf while you were employed, and then the government actually subsidized that. So this became a huge flashpoint, again, a kind of a foreshadowing for our conversation about portable benefits. This became a big issue during the pandemic when a lot of the folks who were essential workers were gig workers, and they were left out of unemployment packages when they did lose work, right? And that's why there was a big movement to make sure that they were covered by unemployment. It was called PUA, Pandemic Unemployment Assistance. They finally were covered, but in the end, that meant that taxpayers subsidized it because Uber and Lyft and DoorDash had never been paying in on their behalf. So that's, again, at the crux of the kind of portable benefits conversation, but it's dependent on folks, on employers paying in, and the government subsidizes it. The exception here is, not exception, but the kind of asterisk is Social Security. So if you're employed by a W-2 employer, they pay your whole Social Security contribution. If you're 1099 and self-employed, you still have to pay Social Security, but you pay for your whole contribution. So you don't get that subsidizing by your private employer, which can be a lot of money, right, that you're paying in on your behalf. And then finally, there is this set of public benefits that are government provided completely. But the issue with these is that they're means tested. So you have to be earning below a certain income to actually receive these benefits. So healthcare in the form of Medicaid or Medicare. SNAP is food benefits, what was traditionally known as food stamps, but now it's Supplemental Nutrition Assistance Program. A lot of acronyms here. TANF is Temporary Assistance for Needy Families. So that's actually cash-based relief. WIC is Assistance for Women and Children. Oh, do we have a question? FPL. Oh, federal poverty level. Thank you, Alberto. So the earnings is typically around 130% below the federal poverty level. It's different by benefit and by state, but that's a typical one. EITC and CTC, those are tax credits you can get at the end of when you file your taxes, the earned income tax credit or the child tax credit. LIHEAP, and I think in New York it's only known as HEAP. That's the Low Income Heat Energy Assistance Program. So that's to get assistance with your heat bills. ACP is Affordable Connectivity Program. So that's to get assistance with your internet. And then Section 8 housing is housing assistance. So these are all publicly offered. It's a patchwork about how good they are and how protective they are, right? A lot of people advocate that all of these benefits should be turned into cash-based benefits, which is something that the guaranteed income movement is kind of moving towards. But right now, in order to receive them, you have to be earning very, very low amounts. And these amounts are kind of historically based. They were developed in the 50s. So they're typically not a good, if you looked at the levels, you would think those aren't little, you can't live for much more income than that in most places, but you don't qualify for this support. So this is really not in place of government benefits. And I'll just check the chat. Not representative today, exactly. They were based on, I think the origin is in the 1950s when your food budget was meant to be 50% of your income, which everyone who lives in New York City could tell you that's likely your rent budget, not your food budget. So the levels are really, really off and they haven't been updated. Some people are moving towards something called the self-sufficiency standard, which is meant to be a much more accurate representation today, but governments haven't taken that on yet. Definitely rent. I feel you. We just moved into a new apartment, so we're feeling it. So these are great benefits, but they're really hard to get. Great. And then, oh, sorry, now I can't move the chat. Hold on. Okay. Great. So I'll just dive into these for a second about how to access them in case it's relevant. I think this website is the best. I'm going to just show you one other. I'm going to just click on it so you can actually see if this is helpful in case. Nope, hold on. Sorry. Here we go. Can everyone see that? The mybenefits.org. Great. Okay, at the bottom of this is, you can also go to like newyork.gov, but I think this is much easier to navigate. And on the bottom, you see like there's links to every benefit program we just talked about. So SNAP, temporary assistance for needy families, that's TANF, HEAP is LIHEAP, WIC is women and children. There's also school meal programs, Medicaid, Child Health Plus, right? There's all the health insurance ones. There's a ton of links here. And then you can also apply directly through this website. Excuse me. So this one's really good. Yes, I can provide the link in the chat right now. That's a great one. And then another really good one, which is on my next slide, is called findhelp.org. This used to be auntbertha.com or auntbertha.org, excuse me. And if you put in your zip code and hit search, there's a ton of resources. The nice thing about this one is it's not just government programs, and they might not be means tested or dependent. So some of these are going to be government programs. Like if you do help finding housing, help pay for housing, it's likely going to bring up some government ones. Same with transit and health, but there's a lot mixed in that are not. And these ones, the hard part is these might not be sustaining programs like year over year, but they could be temporary help right in a moment. So like if you need help in that moment, but it's definitely like emergency food, for example, that's not going to be monthly SNAP benefits, but it's going to help in that moment. And then there is, then you could also apply for SNAP as well. So this is just a really good resource. It says food pantries, financial assistance, everything. And we've recommended this a lot for programs that we're working with. So those are both really good resources. And then I'll see if I can pick it up from here, actually. Slideshow. Great. Okay, so this is just another good resource. So these are the two I would start with. I think the one complicated thing, and this is something that we work on a lot at Steady, is proving your income when you work in a non-traditional way. So another I think barrier for accessing help when you work non-traditionally is that you have to prove your income, and you're not required by law to receive a pay stub. You should be receiving a 1099 form, but you're going to receive that from each individual employer that might be hiring you. So it's really incumbent on you to show your income. And oftentimes the ways you could show it, like your annual tax return from the year before, is going to be really out of date for this year, right? Because it's not a standard job where you're earning the same amount every month. You might be having a bad year or a good year, less income, more income. And that means that actually you could be eligible this year, but you weren't eligible last year. So you don't want to use your tax return from last year. So you can use 1099 forms, but that also means that everyone who employs you has to provide you a 1099 form, and you have to track them down in case they didn't, which is sometimes troublesome. You can provide bank statements as well to show your current income. Profit and loss statements is something you would write yourself. So like an Excel sheet that kind of shows your profit and losses. And then your self-employed pay stub. So this is something, I don't know a lot of people who do this, but you would actually create your own pay stubs. And to be considered legally valid, you have to include your gross pay, your deductions, and your net pay. So this is something that we are working on at Steady. We have created a solution to help people prove their income if they have non-traditional income. And we're working with governments. Right now, we're working with Missouri for SNAP benefits to help people who are self-employed go through our system. It takes about 10 minutes, and then they can prove their income, up to the last minute, because it relies on information in your bank accounts and your work platforms. But right now, to access in New York State, you'd have to cobble together kind of some series of this. So it's just helpful to know this going into looking for benefits, because it might be something that is asked of you. And I have found in my work that this is often the place where we lose people. So you're interested in applying for benefits, you need the help, but kind of getting to the stage where you prove your income is so overwhelming that kind of like, here's all the forms you need to provide. And that's often where people don't come back. So I think it's really important to be prepared here and to be able to show your income. I saw there was a question. Any recommendations for lulls when it's hard to contact those agencies? Yeah, it's a very good question. State agencies are very, very hard to get in touch with. You could try like lodging a complaint with the like overseeing agency in New York, might be a pathway. But it is tough. And in the pandemic, unemployment agencies were completely backlogged. So people had a really hard time getting in touch. It should be better now. But let me think on that. Sorry, I don't have a better answer for that, but I'll keep thinking about that. And I can ask my colleagues too if they know of any way of getting in touch. Okay, so let's talk a little bit about portable benefits. So this is different than public benefits because this would be a version of benefits that aren't means tested and aren't requiring you to earn below a certain income. So the idea here is that everyone should have a safety net, a way to retire, right? Savings, all of that stuff by virtue of working, and that shouldn't be dependent on your employment type. So this came from a guide I co-wrote for the Aspen Institute that's about portable benefits. And the idea is that the model of benefits, which are those that are offered by their company, by a company for their employers, don't work when workers are no longer tied to companies, right? But the problem suggests a solution. If workers no longer need to be housed in companies, then neither do benefits. So there's this potential to create portable benefits, which would be benefits that are tied to an individual worker rather than to a specific job, so that benefit coverage can follow workers wherever their work brings them. So the idea, in my very bad diagram here, is that our current system is the gray person is an employer. An employer provides a set of benefits, and then those benefits are given to each person who works for that employer. In a portable benefit system, you would have every employer contributing some part to benefits for people who are working for them. And then each person has their own little benefits like net that they carry around with them. So they have no matter what. So if you're working across 5 different jobs, each of those employers would pay into, there's different ways that are being proposed to do this, but would pay into a portable benefits account, and you would be able to have benefits that stay with you no matter what. So each employer would kind of be responsible for paying some portion of your benefit, and then you get to kind of form this benefit net for yourself. So instead of being tied to an employer, it's actually, in this scenario, it becomes tied to you. There's a ton of questions around how this goes. And this is kind of what I wrote my dissertation about, is like, how would you actually design this, and what are people suggesting? So, the first question is, which benefits are actually most meaningful to workers? Is it health insurance? Is it 401k plans or retirement? Is it transit plans, food assistance? Like, what are the benefits that actually really matter here? And then again, are these publicly or privately provided? So do we actually make the government, the federal government, provide portable benefits at the federal level? One version of that would be universal health care. You get health care no matter what. It's provided by the federal government. Or is there an arrangement where this is privately done? So an Uber, a Lyft, a school that employs you, everyone privately pays into an account, and then you pick your benefits. The benefit of public insurance here is what I was saying about kind of risk pool. It makes insurance much cheaper, and you can actually cover people much more easily. When it's done privately, you might not be able to actually get really good coverage. So if any of you have had experience with the ACA market plans, sometimes it's a lot out of pocket to get a plan that's not that great because you're individually buying it versus like kind of having this pooled insurance. And that's really the last part here is, are you going to have like a portable benefit account where you're being paid a certain amount and then, you're picking your benefits, or are these larger risk pooled systems? So how portable benefits actually gets designed is really dependent on answering some policy questions first. But I think, as we'll talk next, it also just depends on the political environment to make it happen. That might answer these questions for us instead of us being able to design them, from the ground up. So I would love to bring Eddie in to have a little conversation about where we see portable benefits today. Hi, Eddie.
Hi.
Yeah, go ahead. Sure.
No, I was actually just going to say I'm really, really honored to be a part of this conversation, and that, I know your work. I've read that Aspen Institute study. So, thank you very much for having me here.
Thank you. That's the first person that's ever told me that. So thank you so much. That's very cool. Great. Yeah. So I prepared, a few questions for us to talk through. So I'm going to, pose them to you, and then we can talk through them. So yeah, I think the first important question is, what's been our progress in terms of portable benefits policy in the last 5 years, or before that? And can you lift up any recent examples?
Sure, thank you. So, I mean, the biggest one is the one that you actually mentioned very early on, which was, the expansion of unemployment insurance to independent contractors, thanks to the CARES Act and the Pandemic Unemployment Assistance Program. We at Grantmakers in the Arts are really interested in the expansion of portable benefits because we believe that grants coming from foundations or even, local or state arts agencies are a drop in the bucket in terms of making art making livable. So, artists ultimately need large-scale public supports like unemployment insurance. And so therefore we think that grants have their place, but if we're doing our jobs correctly, we're trying to leverage much larger dollars than grants can provide. So we've been advocating our federal legislators to return to a system of unemployment insurance for gig workers. Obviously, we know the Congress we've got right now, so our priorities have shifted. Now it's just, let's keep the government open, let's remain a democracy, then let's expand unemployment insurance. But, in a perfect world, the government would contribute to benefits by increasing an existing tax or introducing a new one on certain products or services, which is, how currently the model for a range of public benefits and services. But, the government could also engage the business community, requiring them to contribute directly. Like, this is how San Francisco's healthcare security ordinance works, right? They require that employers spend a minimum amount of money on healthcare benefits for their covered employees, even if they're temporary, even if they're part-time, even if they're commissioned or they're contracted. There's also the Massachusetts paid family and medical leave policy, which makes employer contributions mandatory for any business with a workforce comprised of more than 50% independent contract workers. And some employers push back against these kind of public mandates because they're concerned that this is a slippery slope towards classifying independent contractors as employees. But like, for instance, Washington state's legislation includes a hold harmless provision that contributions to portable benefits don't impact a worker's status. So they can remain independent contractors even though they're getting that benefit. And they did that, in part so that employers wouldn't push back quite as hard. There's also situations, and you began to allude this in terms of the private contributions. Customers may also contribute to gig workers' portable benefits. New York City has a mandatory 2.5% customer surcharge on each black car ride that pays for workers' compensation. Alia is a portable benefits platform created by the National Domestic Workers Alliance. And that offers paid part-time off and several types of insurance through a voluntary customer contribution. Workers themselves can contribute toward a benefit fund that allows them coverage at a lower rate than they'd pay as individuals because it's a pooled fund, right? Now, this is how the freelancers union operates. Now, this is not a solution, obviously, in and of itself, because few workers are able to cover this expense entirely. And ultimately, and you know this better than I do, voluntary support from employers or customers will remain marginal. These examples are all small scale, and they provide only part of the resources needed for only a few benefits at a time. We contend that public policy at the local level, at the state level, at the federal level is really what's required to ensure that one of the fastest growing group of workers, gig workers, has financial security. Now, there have been legislative proposals advanced from across the political spectrum to address these challenges. Bipartisan federal legislation has been proposed in Georgia, New Jersey, and Washington State. And Washington State has just passed. It just passed recently, although now there needs to be another round of the legislation for it to be enacted. It's law. It's just, a service provision needs to be addressed. Now, we are really excited because federal legislation has been recently introduced. This is just a few months ago. Senators Mark Warner and Todd Young and Representative Suzanne DelBene introduced the Portable Benefits for Independent Workers Pilot Program Act. Now, this would establish a portable benefits pilot program at the U.S. Department of Labor. This would authorize about $20 million for competitive grants to state and local governments and nonprofits to design and implement and evaluate new models or to assess and improve existing models for portable benefits for independent workers. Now, eligible models should provide any number of work-related benefits and protections like retirement savings, workers' compensation, life and disability insurance, sick leave, training, educational benefits, healthcare, more. And I'm actually going to put a link in here with more information on that. Let me grab this one. There we go. So that is my long-winded answer.
It's a fantastic answer. Oh, I didn't mean to click that. I was trying to click out of the chat. Yeah, I think you lifted up a ton there, and I think I'll just actually double click on the example of ALIA with the National Domestic Workers Act, and with the National Domestic Workers Alliance. It's a really, really good example of a group that represents workers getting policy passed. And the kind of route by which they did that was say that this was a problem, say that domestic workers, particularly house cleaners in this case, because a lot of nannies were hired full-time, but house cleaners weren't given any benefits. They built the technology, they built a platform to be able to do it. And then they went to local lawmakers and they said, we could do this. It exists. Here's the technology that we could use. Here's the reasons why. Here's all of our advocacy efforts. So they kind of combined this approach on how you would implement it with advocating for it. And they got in Philadelphia, they passed, it's just for paid sick time for domestic workers, for house cleaners in Philadelphia. And they're also still working out the implementation there, but it got passed, right? And in all of the kind of the meeting notes that I looked at from these actual legislative sessions, it was really important for lawmakers to see that it could be done with this technology, and that helped them pass it. And I think that's something that's often lost at the federal level. It's like, how are we going to do this? And the example that you gave for PUA during the pandemic is like, that's how we did it, right? It wasn't perfect. A lot of people had trouble proving their income. It was being subsidized by taxpayer dollars, but it was provided, and it's possible for us to do it. So I think, even though it's very frustrating that a lot of the pandemic efforts feel like they've gone to the wayside, as you said, right now it's just about keeping the government open, having a democracy. I do think that they provide a blueprint to say, like, we've done this before, it's possible. Whoever says we can't do it, it's not really true. It's possible to do, right? And we have these good examples. As you said, the Black Card Fund has been running since the 1970s. So any person that's driving a car, that includes also Uber and Lyft now, as Uber and Lyft came out and the rideshare services, they got added to that kind of mandate. If something happens to you in your car, you're insured. And that's because in the 1970s, they formed this program, right? And we're all paying for it, as are employers as well. So I think it's really good examples. The last one I'll also talk about is the SAG-AFTRA model, which is more of like a union-based model, but it shows how it's possible when there's folks who are working as independent contractors, but they're working within the same industry, actually. So they're all working on movie sets, on TV sets. And I spoke to the executive director of SAG-AFTRA when I was doing my PhD, and he told me, they have like a Robin Hood model where the wealthiest the people who are making $5 million on set are paying for the health insurance of all of the camera grips, all of the makeup people, right? That's all going into this fund where they're actually able to receive benefits. So that's a very industry specific example, but I think it shows that it's possible to do this in different ways. And there are funding streams that will exist, right, to do it. And if we want to go the kind of union-based model, that's an important mechanism for worker power at the union level. And a lot of the portable benefits policies have been tied with kind of a union proposal where it's a union-like or labor-like organization who's actually responsible for administering the benefits, because that's a mechanism to increase worker power. So I think that's really exciting too.
Yeah. No, it's great to hear you explain those examples, because, like, for instance, the Domestic Workers Alliance effort, we've been trying increasingly to frame grant making as the development of an evidence base for policy interventions, because so often that's exactly, you hit it on the head when you said so often the challenge is just imagination on the part of legislators. Well, how could that be done? What would that look like, et cetera? And, grant makers have the opportunity to support, I know Sarah Calderon is on the call. If we're able to lift up Creatives Rebuild New York and say, this is what this looks like in real life, we would need you to pass legislation that would scale something that already exists. Then you're already creating an evidence base so that people don't have to do some huge leap of imagination to imagine what it would be once that legislation passes and it has to now get enacted.
Absolutely. Yeah. And we at SETI have been working with Creatives Rebuild New York since the program started. So huge fans of Sarah and Creators Rebuild. Yeah. So I want to turn a little bit, and I think you kind of hinted at this, but what's preventing these policies from getting passed, and where is the resistance coming from? I'd love to dive into that for a second.
So, I think there's a couple of places. One of them is, the model of this being covered by employers or even employees, by its nature, is going to remain marginal. And we think for it to become sort of robust and at scale, it simply requires new taxes. It requires, raising revenues. And that is so frightening to so many legislators. And there are so many, sort of well-positioned lobbying groups who would lobby against new taxes, so there's that. Then the other issue is that we've just recently begun to encounter, and we're pro-union, but we're finding that unions are not opposing these efforts, but they're not supporting these efforts. And their ambivalence is, completely rational. I get where they're coming from. They're basically framing this as, not in the public discourse, which I'm grateful for, but they're basically framing this as this becomes another reason to either, one, misclassify workers who should be full-time employees, or two, simply not hire folks as full-time employees, to keep people in a situation where they have to cobble together a living. And so in response to that, we're trying to do kind of two things at once. We believe that unions are great things, and very specifically, they're worried about the PRO Act. The PRO Act is a really, we think, a great piece of legislation that just allows for more effective organizing of workers. And right now, a lot of political will is going into that, and we are supportive of that. We do not want to distract from that. So we're trying to be as pro-union in the public discourse, as pro-union as possible, on one hand. On the other hand, we're also trying to make clear that these don't need to be mutually exclusive, that the folks that we are trying to represent are those for whom part-time work actually works for them. Maybe not all their lives, but for artists, there are points in their lives where part-time work is ideal because they have such and such going on in their creative lives, and that's a very unusual circumstance that basically requires a lot of education on our parts, because that's not true of most industries. There are very few, professional full-time drivers who would really rather be a part-time driver. You know what I mean? So that is basically what we're trying to do to get around those two hurdles.
Yeah, I think you hit the nail on the head, and that absolutely in terms of resistance, I think, I said there's general resistance to new taxes. There's also general resistance to anything that feels like it's socialism or collective. Right. So, a version of universal healthcare providing benefits for everyone sounds like we're going down that road. So that, hits the normal pushback that it gets in our country. But I think there is portable benefits became very tied up in conversations around platform work in particular. It was in the kind of one of the first convenings about it. There was labor leaders there. So David Rolfe, who was the leader of SEIU, the Service Employees International Union, was there, as were, the CEO of Uber and the CEO of Lyft, right? And I think the tech companies saw portable benefits potentially as a way to make sure that they could continue to hire people as independent contractors, which meant that they weren't paying not just for benefits, but also taxes on them, right? A bunch of other stuff that they would be having to do, right? That would make, their business model likely much less solvent. But they should have planned for that, right? So they got they thought that creating portable benefits might be this way to potentially, kind of enshrine this independent contractor status and kind of get lawmakers off their backs around not providing benefits. And because it got tied to tech companies in that way, more traditional labor unions had a big issue with it, right? And put up a fight and felt like it should be that everyone is classified as a W-2 employee and we're not going to give this kind of concession. So in California, they were on the verge of passing a bill that would have brought portable benefits. At the very last minute, the labor union, who were at the table, right? The kind of older school labor were at the table. They squashed it at the last minute. And instead, what got passed was AB 5, which was a rule to make everyone W-2 workers. Of course, tech companies responded in force, with lots of ammo, and they launched this campaign for Prop 22 in California, and they brought it to the ballot, and they launched a kind of major marketing campaign to convince people to vote against it. And what happened was that people voted against it. And so AB 5 went nowhere, and also no one got portable benefits. So I often see that as the issue with that kind of like lack of compromise and willing to sit at the table is then when the pandemic hit, all those folks in California would have been covered, right? Because at least portable benefits would have been in place in some shape or form. So the kind of unwillingness of the kind of old school labor model, unwillingness to compromise meant that a lot of people went uncovered. And so this resistance is kind of it sometimes comes with portable benefits between the kind of like platform and tech companies and some of the labor folks, as you just said. But what you hit on is that it's not mutually exclusive and it isn't an either or. And by providing portable benefits, we're not actually making a statement about full-time classification. Portable benefits can be provided outside of that kind of classification structure. So that's kind of why it died on the vine for a while. But as you were talking about, Washington just passed something. There's efforts with domestic workers. These things are still moving forward, but that was a big blow, I think, to the kind of portable benefits movement.
Yeah, agreed. And if I don't know what the ultimate solution is, but we are on our part trying to make clear that we are pro-union. One, two, to make clear that there are folks for whom at various points in their lives, part-time work is actually conducive to their livelihoods. That they can have an artistic life as well as a gig.
Absolutely, yeah. And I think perfect segue to our last question. I mean, this is one I think you can speak much more about than I can. Is what are current ways to get involved, especially for the folks on this call? And, how can they help in supporting portable benefits advocacy efforts?
Yeah, so I'm including a link here. We're basically encouraging folks to support the Portable Benefits for Independent Workers Pilot Program Act. This would basically allow the federal government to set up a fund that would then go to states and localities to set up local portable benefits programs. So one, but two, what we're trying to do to complement that is to lift up examples of folks who are already doing it, so that they have an evidence base. So like obviously, I've brought up already Creatives to Rebuild New York, but Springboard for the Arts in St. Paul is doing great work. Yerba Buena Center for the Arts in San Francisco is doing great work. There's Culture Source out in Michigan. There is the Arts Alliance for Illinois that is doing really good work in these regards. And it provides them with the opportunity to say, oh, I want to stand this up, but, I'm worried about the establishment of the infrastructure. And we maintain that versions of the infrastructure already exist. You just need to resource them at more robust levels.
Awesome. Yeah, I think that sums it up. The links are in the chat. I think we can open to questions if there are any. If you hadn't put them in the chat yet, we're happy to take any questions you might have, either in the chat or come off mute.
I'm going to put another article in here about portable benefits, some legislation that is out and about in the world.
And you can also feel free to reach out to either of us. We're available to talk anything portable benefits or benefit structure, or see how we can help. We're around and very passionate about this. So Kinsey, I don't know if when the follow-up, you can provide our email addresses too. That would be great. Examples in New York State in terms of portable benefit. Oh, thank you. Okay, just saw the New York State. So there aren't in New York State, there's just in New York City, which is the Black Car Fund that provides workers' comp to rideshare or black car drivers in New York. I don't believe that there's anything that's been passed in New York State. So David, yes, marketplace insurance. Yeah, Medicaid or marketplace insurance, I would say are the best options. There are some private health insurers that might provide it, but I don't think you're going to get as good of a deal as you'll get on the marketplace if you apply for what's called the CSRs, cost sharing reductions, or the APTC, the American Premium Tax Credit. Both of those are ways to reduce the price of marketplace plans on the marketplace if you qualify for them. And a really good website to go through. Oh, actually, Health Sherpa might not serve New York because New York has its own marketplace. It's not tied to the federal marketplace. You could try Health Sherpa. They tend to have plans. Otherwise, yeah, the marketplace insurance options are definitely likely the best. Oh, and Kinsey said, yeah, there's going to be another part of the series that dives into that. I used to work for a company that was called Catch. It was a portable benefits platform, and it was tied to the marketplace. But we could only serve states that were tied to the federally mandated marketplace, and New York is one that has its own. Oh, thank you, Cassandra. So glad it was helpful. Make sure, I think the biggest thing with public benefits is that there's actually a lot of help out there. It's just about going through the frustrating paperwork to get it. So getting the tax credit or the cost sharing reductions could make, I think, a silver plan, which is relatively okay, much, much better than a gold plan. That's one of the things that's been proposed, Alexis. Yes, like that it would almost model the Social Security of today, right? So you would have a number that's associated with you, or an account, right? However you want to say that, and that follows you wherever you are. And that should be considered collective instead of socialism. But that's how a health insurance version would work. Health insurance would be like, it's how it works in other countries where you have healthcare for all. Like you have your own account, you receive that healthcare, right? It's at the federal level, and it follows you no matter if you lose your job, anything like that. Yes, I'm happy to provide the deck. And in the, I can also link to the portable benefits guide I wrote for Aspen. We talk a little bit about that kind of history of that risk shift in that piece as well. So we can provide that afterwards, but I tried to do a high level summary there. But yeah, the idea was that, the government felt like this should be an issue that everyone solves together. And then of course, in this country, we move towards it being up to every individual, like we've done for most things. But there was an era where we felt like this was really something the government should take on. And that's kind of the idea behind portable benefits now, is like you should be covered with a benefit structure, no matter your work type. It's really archaic that just because you don't have W-2 employment, you don't get any benefits, right? Or you have to cobble it together and figure it out yourself. So that's the idea. Sure, yeah, we can definitely provide it. Oh, when did the portable benefits discussion begin? So in my dissertation, I traced that to this convening that the Aspen Institute held. I think it was in 2016, where they brought together a bunch of labor leaders, a lot of the platforms, a bunch of like think tank folks like Aspen Institute, and I think it was called the Portable Benefits Convening. And that was when the conversation of it in the current form came about. I think, as we can tell by the Black Card Fund or Social Security, there was versions of portable benefits before, but they just weren't branded as that. And of course, in our modern era, we have to brand it and market it. So like in 2016, when all of these tech folks and these labor folks met, they decided that, this would be about portable benefits where they stay with you. So that was kind of the origin story, at least as far as I could tell in my research. Interesting. So for part-time, but also W-2, there's typically like a different set of regulations. So employers don't always have to provide benefits for people that are part-time. And that, I think, is what Eddie was talking about, that we're advocating for you're advocating for the fact that part-time work serves people in some moments. It depends on the benefit as well. It's a little bit complicated, but for some benefits, you might still get access if you're part-time, but for a lot of them, you're like not covered by law if you're part-time. I don't know if you have anything to add there, Eddie, to that question, to Courtney's.
No, that sums it up perfectly.
So that's huge, right? And there shouldn't be distinction around W-2 versus 1099 or part-time versus full-time, or right? Because all of those distinctions collapse when you just think about work as you're being paid for your labor, right? And that should really be what determines the set of kind of protective benefits that you have. Super important. Well, Kinsey, I'll turn it back over to you to close. I'll stop the share. Thank you so much. I really, really appreciate it. It was really great to talk to everyone. I appreciated the engagement at the end too. Thank you.
Likewise, this has been a pleasure.
No, thank you both so much for being here with us this morning. I feel like this is such a vital, important conversation. And I feel personally that I've learned so much in like sort of trying to get this session off the ground, chatting with you both over email and whatnot. And now having this conversation today, it's just fascinating and so important. So thank you both for being here. And thanks for everyone for joining us today. This series will continue. Yesterday and today we had morning sessions. Now we're transitioning to afternoon sessions for the next 3 days. I just want to acknowledge that someone asked me in a message, do I have to register for a specific session moving forward? No, you don't. If you registered for this series, you're going to get every link, every reminder, every recording, every resource. You're getting everything. So just keep your eye on your email. I'll be emailing later today with a link to tomorrow's session and probably a reminder tomorrow morning as well. So tomorrow's session, if you can join us, is from 4 to 5:30 p.m. It's called Navigating the Mental Health Landscape as an Artist. I'm just going to put our event page in the chat again. That way you can kind of look at what else is coming up during the week. Tomorrow we'll be with Creatives Care, and we'll be talking about accessing affordable mental health care as an artist or an arts and cultural worker. Following that on Thursday, we'll be with Entertainment Community Fund. We're going to dive much deeper into how to access the most affordable insurance for yourself if you are in New York and you're under the age of 65. So I hope you can join us for that. And then we'll close it on Friday with TribeWorks talking about some collective care models. So everything is in the chat. If you have questions or anything, please feel free to email me. And I will connect you with who you need to chat with or send you any links or resources. You will be getting slide decks and all of that good stuff after the series closes this week. And I think that is it. I will let you all go. Thank you again so much, Eddie and Lexi, for your time. We're so grateful to you. And everyone have a wonderful Tuesday.